Dr. Morey, Uncivilized Vitality. This is the anatomy playlist or channel. And this is the integument or skin integumentary system part 2. So I've doodled up a little picture here, and we've got 3 layers. We talked about this in the other video. This is the epidermis. And then from here to here, 80% of the thickness is the dermis. And then you have the hypodermic or subcutaneous layer. I'm just going to write sub-Q. Right? So the skin we talked about before serves, in the other video, several functions. We've got protection, regulation, the formation of vitamin D. Check that other video out. But it's got a couple of different accessory organs. I didn't show the fingernails in this one. I'll do a third video, integument, would detail the fingernails and how they come from the fingernail bed and the little lunella and all that, the finger and toenails. But for now, we're just going to talk about the 2 glands and the other accessory organ in the integument system, which is hair. So the dermis at this layer here, between the epidermis and the dermis, you've got all these little folds and wiggles. These are called the dermal papillae. The papillae are these little bumps and wiggles, and it helps kind of hold the epidermis, or those simple, those stratified squamous keratinized tissues. That's where they develop and sort of float up or migrate to the surface of the epidermis, and they begin here at this junction. You're going to find in the dermal layer, you're going to find a couple of different structures we're going to talk about. And you can think about some of those structures as passing through the epidermis and having these little openings in your skin that you normally refer to as a pore, right? Or pores in your skin, those little holes or openings. I only do one hair here, but all of your skin everywhere is covered in hair. And depending on how closely those hairs are situated or how dense they are, how thick and long, is mostly genetic. But you can find hair consistently in certain places on human beings where we have larger blood vessels in the dermal layer or the subcutaneous layer, and we tend to lose more heat. Armpits, top of our head, around our genitals, in the groin. Lose heat there, you're going to find more hair there as an insulative. There's some pheromone properties too, but I don't want to go too far. Keep the video short, I was told. So back to dermis. We'll talk about just one hair in this picture. It also is going to come out of a pore there. You have hair everywhere except a few areas: lip skin, nipples, palms of the hands, soles of the feet. So-called glabrous skin or hairless skin. But if you zoom in real close, you've got hair even on little downy hairs, even on the surface of your face or everywhere else. Now, the hair is going to erupt through a hair follicle or an opening, a pore, where the hair sticks out. And then it's down in this dermal area where the hair follicle sits in to the dermal layer and anchors at the base of the dermis and the subcutaneous layer. And this hair sits in this, the shaft of the hair comes up, sits out of this follicle, and there are 2 structures associated with the hairs. One is the arrector pilorum muscle. Your arrector pilorum or arrector pili muscles attaches to the deep surface of the epidermis and in the dermal structure itself, some of the dense connective tissue. And it pulls on the hair in such a way that during autonomic arousal, the arrector pilorum muscle will contract and help the hair stand upright. If you were covered in hairs, this would help fluff you up, increasing your insulative value of the hairs. It would make a dimpling in the epidermis, which we sometimes refer to as goose bumps or goose pimples. And it would also help move the hair around to help spread some of the oil on your skin, which helps your epidermis stay moist and retain some of those keratinized cells so they don't flake off too quickly, losing some of the protection, the mechanical protections they afford. So the hairs also, you can think of them as sort of mops that move the oil around on your skin and distribute it to keep the skin moist and supple and doing its job. This oil is produced and deposited right at the shaft of the hair follicle into this little opening by this gland here, which I've drawn in blue. And this gland is the oil gland, or we're going to call that a sebaceous gland. You might not be able to read that on the on the board so well, but you can Google it and look it up, or it'll be in the description. Sebaceous gland. And you can think of the sebaceous gland as your oil glands. Now, sometimes you will get the hair will be ripped out or shaved off or plucked out or whatever, and you'll get maybe some keratinized cells will impact the opening to this hair pore, hair follicle, and you'll get a backup or a back pressure, a buildup of the sebaceous secretions, and you'll get a sebaceous cyst, which can elicit an autonomic, or not autonomic, an immune response, and you get some pus in there, and basically it turns into a pimple, right? A sebaceous cyst. There are lots of other things that go on in the integumentary system. 2 videos obviously is not enough. There's an entire field of medicine called dermatology that deals with all these things, the sebaceous cysts and the comedones, the blackheads, and the different things that can happen in the dermis and epidermal layer. But for us, erector pylorem muscles lift the hairs up, move the hairs around due to autonomic excitation. Sebaceous glands deposit their secretions into onto the hair follicle to be moved around, and it kind of helps keep the skin supple. The other pores that open up on your skin are sometimes filled with these type of glands, and these are sudoriferous glands or sweat glands. And this is where there's going to be some excretion here of water and some salts. We're going to use this to cool through evaporative cooling on the skin. We'll draw some of the heat from some of the vasculature that's in the dermis, the arteries and veins, which I've drawn here in red and blue. And obviously they're carrying the warm blood, which might snake up above the insulating layer, the subcutaneous fat layer, and then it'll heat up this dermis. And if we want to let some of that heat off, we might produce more of the sweat from the sudoriferous glands, and then that gets on the surface of the skin, and through evaporation we get that convection and evaporative cooling, pulling some of the heat. When it's cold out, one of the things we'll do is the erector pylorem will stand the hairs up so they're not lying flat on the skin to maybe trap some more air to keep us warm, and we might shut the sudoriferous glands down or decrease their activity, thus retaining some of the heat. The other thing you're going to find I've drawn here in green is you'll see these free nerve endings. These are the type C, not a very large diameter, and an unmyelinated neurofibril type. And these free nerve endings are where we get pain or noxious stimuli or tissue damage. And then one of these kind of fires off for no reason, or idiopathic activation. We call that an itch, all right? That would be one of these things. And then it usually will cause a feedback loop, modifies your behavior, so you'll go in and cause some mechanical stimulation of the epidermis and dermal layer around that free nerve ending, just sort of like rebooting your computer. This is on for some reason, sending the signal into our brain, which we interpret as a pinpoint sensation, like an itch, we call it. And by providing some mechanical stimulation on the surface, you can sort of reboot and shut that off so you can get rid of the itch. Although sometimes that itch shuts this one off and activates those, and it can cause more itching. There are other receptors, Ruffinian corpuscles and Merkel discs and such, we'll go into that in a neuro video, that are also in the dermis and the epidermal junction that provide pressure, vibration, other types of sensory feedback to your brain. But most of these free nerve endings are the ones that are in your skin to let you know that you've got a paper cut or a bruise or damage or an itch. Sunburn, mosquito bites me here, and I get a histamine reaction from some of the white blood cells, the macrophage, monocytes, and such that are coming up, and they'll cause the histamine will fire these off. That's why mosquito bites sometimes can itch so much. So this is the integument 2. There's the layers we talked about in the other video. Just kind of a quick drawing so you can get familiar with sudoriferous glands that produce sweat for regulation secretion, sebaceous glands which produce the oil and empty directly into the hair follicle, the erector pylorem muscle which stands that hair follicle up, and some of the sensory and vasculature structures that are in the dermis and epidermis, and then of course the subcutaneous layer, which is mainly fat for cushioning and protection. So that's the dermis. If you enjoyed that, I think I can do integument 3 for nails, and then we'll do integument 4, and we'll talk about more of the sensory stuff, but we might put that in with neuro. So if you like that, thumbs up on the video, make a comment about which of those other videos you'd like to see next in the anatomy playlist. Subscribe to the channel, notifications, send Logan a compliment saying thumbs up on doing all the videos. So that's it.